Everyone, Luke here with a quick presentation about blood loss. We'll start with minor bleeding, and what we'll look at specifically is an abrasion and a laceration. So through the middle of this picture here, you have a laceration, and on the outside you have more of an abrasion. Main treatment is to apply direct pressure to stop the bleeding. Then you need to wash the wound with either water or normal saline. Now, saline will come in small tubes. Make sure it's a clear fluid, and it should say on it 0.9% sodium chloride, or it may say something like eye wash on there as well. From there, you can see in the picture they're using sterile gauze to clean any sort of foreign bodies out of the wound. And from there, once the wound looks nice and clean, the bleeding is contained, you can cover it with a dressing. So you can use island dressings there, like a low adherent dressing, and you could also use Band-Aids as well. Next up is a nosebleed. So there's heaps of myths surrounding the treatment of nosebleeds. Now, people put their heads back. In that sort of case there, if you put your head backwards, so you tilt the nose up towards the roof, in that sort of scenario, what will happen is the blood, chances are you'll swallow it and it will go into your stomach. It can make you feel a bit ill. There's even some cases where people begin vomiting. So a better option is to pinch the soft part of your nose, bend forward from the waist, similar to the man in this picture here, and breathe through your mouth. From there, you could actually put ice on the back and the front of the head, and that can constrict blood vessels. And if the bleeding lasts for longer than 20 minutes, you need medical attention. Next up is major bleeding. So major bleeding, your number one principle, same as minor bleeding, is apply direct pressure as close to the site of the wound as possible. From there, you can, if you have the equipment, you can use a small pad to apply over the top of the wound, and you want to apply direct pressure. Using an X is good. So see here in the picture here, we've made an X over the wounds. This is assuming the wound is like a circular wound over here. You can get more direct pressure there. Things you don't want to use is anything that's going to absorb blood. So tampons, towels, nappies, anything like that, because hemorrhage control is all about pressure, not absorption. If you have no equipment, it's actually better just to use your hand than anything big and fluffy that's going to absorb a lot of blood. Let's say the bandage is filled with blood quite quickly. If you saw an arterial bleed, you may require an arterial tourniquet. Otherwise, if it was just a venous bleed where it's just oozing out of the wound, it's not spurting out of the wound, you may just want to apply another bandage over the top with a tighter squeeze on that wound. Always restrict movement for bleeding as well. Okay, this was what I was talking about with the arterial tourniquet. So arteries go away from the heart, and when they bleed, they will bleed at the beat of a heart because the heart is the pump behind these arteries. So you've applied direct pressure. You've possibly applied that bandage, let's say 2 bandages, and it's not working. You need to decide quickly to move to an arterial tourniquet because this person could have minutes to live. Now, an arterial tourniquet needs to go around 5 to 7 centimeters above the wound, but not on a joint like the elbow or knee. So choose to go either below the knee or above the knee. And think of an artery. The reason being is think of an artery as once it's lacerated or severed, it will constrict, and so it will go above the wound. In this scenario here, we've used a bandage around the arm. We've put a metal object, so in this case here a butter knife, through the bandage and then twisted it up like you're turning off a tap, and you can get a lot of pressure really quickly here. Now when you put it on a tourniquet, it's going to be painful for the person. You want to tighten it until the bleeding stops, and essentially it's when you lose the distal pulse. In this sort of scenario here, the pulse in the wrist down here, you should in theory lose that pulse. From there, definitely take note of the time of application of that tourniquet and pass that information on to paramedics at the scene. Now, a big rule down the bottom here is only use tourniquets on the arms and legs. It's not for any other place in the body. Next part of major bleeding is potentially an amputation. So the arm here has been amputated at the elbow, and the main concern to start with is actually the person surviving. So this person could have a major arterial bleed. You need to take care of the person first and then the limbs second. So taking care of the person, we're going to put direct pressure on the stump, so the upper arm, which is left on the person, and potentially you're going to be looking at a tourniquet as well. So any sort of traumatic amputation above the knee or elbow will most likely require an arterial tourniquet. However, always try direct pressure first. Now, let's say you have the person stable and you've controlled that blood loss. Now you need to keep the limb, which has come off the person and is sitting on the ground, chances are you need to keep that cool and dry. So one of the best methods is to wrap it in Glad Wrap, and then you could put ice around it, but make sure the ice doesn't make contact with the limb itself. And then you want to keep it dry, so that's the critical thing. Don't let the ice make contact with the limb itself. Internal bleeding is next. So we're looking at potential shock for this person, so it's known as a hypovolemic shock. So if this person is losing a lot of blood internally, you may see bruising, they may experience pain or tenderness at the site, and you may even see some swelling there as well. Here's a few symptoms to look out for, or signs to look out for. So bright red or frothy blood coughed up from the lungs. So if you're coughing, it's coming from the lungs. And then if you're vomiting, it's coming from the stomach. From the stomach, you're looking at either bright red or coffee ground type blood, so more of a darker brown type blood. Internal bleeding could also be shown through the urine, so you could have blood-stained urine or rectal or genital bleeding. Now, there's not a lot of treatment that you can do in terms of first aid for this person, but the main thing is call an ambulance, lie the victim down, and keep them warm. To finish with, we're going to learn a method to estimate blood loss. Now, this could either be used to predict how close this person is going into how soon this person's probably going to reach hypovolemic shock, or it could also be used to, let's say, calm people down who are losing a bit of blood, but it's not life-threatening. You can maybe calm them down and say, hey, you've maybe lost 100 mils of blood, which is roughly 5 fists. It's not a life-threatening bleed for most people. So 1 fist is equal to 20 mils of blood. Now, hypovolemic shock generally occurs when you lose 20% of your body's blood or fluid supply. Now, an adult has around 5 litres of blood in their body. If they lose a litre, they will generally go into a hypovolemic shock. I hope you enjoyed the video on blood loss. Thank you.